Hello, class. We have 2 more weeks left in this course. This week, week 6, we will be learning more about humanistic theory and existentialism. There are some really interesting theories and theorists that come out of this week. Both of these theoretical paradigms and approaches are really focusing on how do we recognize self-worth, self-efficacy, and self-actualization. Humanistic theories really focusing on self-actualization, empathy, unconditional positive regard, especially with Rogerian theory and approach. And then we've got Maslow's hierarchy of needs, which is pretty infamous and important to consider when working with patients and providing clinical care. Many of the humanistic approaches are very applicable and utilized and leaned on heavily in how we formulate that healthy therapeutic alliance or climate in the room with the patient. What kind of conditions generally help someone stay positive, instill hope, and move forward. And existentialism is a really, really fascinating approach, examining the meaning behind our choices in life, examining our self-worth in different ways, and sometimes taking a look at the anxiety of death. Both May and Viktor Frankl being some main infamous players in that theoretical orientation, but we will learn of others as well. This week and next week, you will notice that there is just one discussion post and an assignment due. This is your last week of completing a section of the integrated journal. So like last week, you will choose 3 theories from this week to answer the prompts. And then your discussion post today is applying some of the learning more directly to social media. I've really enjoyed reading some of your posts so far. And in this discussion post, you're being asked to consider what might be behind why and how social media is so prevalent and what's happening when we are posting and receiving likes and accolades. Is this something reinforcing and helping self-actualization or related to validation about self-worth, for example? And what might, again, be like the rationale or meaning behind that, and how would you apply the theories to it when answering those questions? And then because we are giving you a break in the sense of not having a second assignment so that you can really start doing preparation for your final paper next week, which if you take a look, it's basically like a case formulation or case conceptualization, however you want to look at that, of applying 5 different theories throughout the entirety of this course, choosing one from each umbrella or paradigm to apply to the case study example that was given for you and provided for you. You know, you're going to describe the theory, you're going to, and how you would apply it to the case, talk about the perspective of what's really going on for this client or patient through that lens, and the problems and issues and problems in functioning and mental health through that lens, and what might be some of the best treatment modalities coming out of that theory that you chose. So this week you can sort of review that, start doing, selecting your 5 theories, beginning to format the outline of your paper and begin it. And then next week, there is not that second assignment with the integrative journal. It will just be the final paper and another discussion post. I hope you enjoy learning about humanistic theory and existentialism and enjoy applying the learning this week. 2 weeks left. Reminder, don't forget to integrate literature as best you can in your work. Don't forget to respond to your peers' posts by Sunday night at midnight. And a reminder that the final week in this course, next week, week 7, late work cannot be accepted for credit. So please keep that in mind. And we are so close to the end. Don't hesitate to reach out with questions. I look forward to looking at your work this week, and I'll have another video next week as well. Thank you. Bye.